Hi, this is Dr. Fox, and let's talk about the parotid gland. In this video, we'll discuss the salivary glands. We'll discuss the parotid gland, its functions, how it secretes, the structures found within it, and any problems or pathologies associated with it. So salivary glands are exocrine glands. That means that they secrete their substances via ducts onto the surfaces of epithelial tissues. So we can contrast that with endocrine glands that secrete hormones into the bloodstream. There are three major pairs of salivary glands: parotid glands, which we will be discussing in this video, submandibular glands, and sublingual glands. There are also small or minor salivary glands associated with various mucosa. In particular, there are labial, buccal, palatal, and lingual salivary glands. Salivary glands secrete with parasympathetic stimulation, and the products of that secretion is saliva. So saliva is an aqueous solution that contains various solutes such as mucus, digestive enzymes, ions, electrolytes, etc. It functions to moisten mucosa, in particular the oral mucosa, where the greatest concentration of salivary glands secrete. In so doing, it also lubricates food to assist in the deglutition process, which is to say swallowing. And the digestive enzymes within saliva begin the process of breaking down the biological macromolecules of that food. When we look at the various salivary glands, we see that most of the secretions of saliva, so about 65% of which is the product of submandibular glands, whereas about a fifth of it, or 20%, is the product of the parotid glands, and the remaining 15% is secreted by the sublingual glands and the various minor salivary glands. So let's take a look at the parotid gland, the star of this video in particular, which is found within the parotid fossa. So let's look at those boundaries. So anteriorly, we have the ramus of the mandible. So this is the ramus of the mandible. The ramus meets the body at the angle of the mandible. And also the masseter muscle, which is located right there. The masseter muscle is one of the major muscles of mastication. That is, the muscles that move the mandible. How alliterative. The posterior boundaries of the parotid fossa include the mastoid process, which we can see there, as well as the sternocleidomastoid muscle. The superior borders of the fossa include the temporomandibular joint, or the TMJ. That is the joint between the articular process of the mandible there and the temporal bone. The external acoustic meatus, which we can see there, that leads to the external ear. And inferiorly, there's the angular tract, which is a bit of connective tissue that we'll be able to see in the course of dissection of the submandibular area. So here we can see the parotid gland in all of its glory. We can also see some of the branches of the facial nerve as they go out to innervate different muscles of facial expression, and also exiting the anterior aspect of the parotid gland is the parotid duct, which I'll outline here. So the parotid duct typically looks quite veiny. It can be variable in appearance, but it to me looks like a vein as it moves over the masseter. So we begin by exiting the anterior aspect of the gland, and it moves superficially over the masseter there. And then it dives deep at the anterior margin of the masseter, which we can see right there. There's the buccal fat pad. So here it's diving deep between the masseter and the buccal fat pad in the buccal space. It traverses that space and it pierces through the buccinator muscle. And the papilla for the Stenson's duct, or parotid duct, is located adjacent to the maxillary second molars, which we can see right there. And so the saliva from the parotid gland empties out into a region of the oral cavity known as the oral vestibule. That's everything outside of the dental arcade and bounded by the lips and cheeks. So when we look at the structures within or deep to the parotid gland, there are three major features that you may see as we look through the gland in lab. So the most superficial of which is the facial nerve trunk. Recall that exits the stylomastoid foramen and ramifies into the temporofacial and cervicofacial divisions. Those will be most superficial. We can see those overlying the next feature that we want to see, which is the retromandibular vein. Posterior to the mandible and deep within the substance of the gland, we can see this vein that is draining the superficial head there, as well as receiving the maxillary vein from the deep face. And you can't see it here because it is so deep, but also within this space is going to be the external carotid artery. And recall its terminal branches are the posterior auricular, the superficial temporal artery and the maxillary artery, which is going to serve the deep face in that infratemporal fossa. So facial nerve, most superficial, then retromandibular vein, then external carotid. So let's start. We've already discussed the facial nerve in this series. Let's talk a little bit about the retromandibular vein. Let's go back to our blue. Go blue here. So the retromandibular vein receives blood from the superficial temporal vein coming down. It also receives blood from the maxillary vein of the deep face. So all of that is in the retromandibular vein. And it is going to come together, or at least parts of its divisions will come together with other features. So we see that there is an anterior and a posterior division to the retromandibular vein. And that posterior division comes together with the posterior auricular vein to form the EJ. That's the external jugular vein that moves superficial to the sternocleidomastoid muscle, whereas the anterior division meets up with the facial vein to have a common trunk that is flowing to the internal jugular vein, IJV. So all of retromandibular vein flows into one of two jugular veins, the posterior division into the external jugular and the anterior into the internal jugular vein. Now let's take a look at the external carotid artery. Let's go red here. So recall the external carotid is bifurcating from the common carotid. There's the internal carotid, which is posterior. It's at this point has already given off the superior thyroid, the lingual, and the facial. As it continues to ascend here, it will give off the maxillary artery to serve deep face, as well as the superficial temporal artery, and we can see branches of that superficial temporal artery all throughout the temporal region. So it's servicing the lateral face and scalp with blood. The parotid gland is not invulnerable. It is subject to infection and other potential injury and etc. So oftentimes various infectious agents can pass through the bloodstream and arrive at the parotid gland. This can lead to a condition known as parotitis, also known as parotiditis, but more commonly you'll see parotitis used. And this leads to inflammation and edema or swelling of the region. So the parotid sheath is rather unyielding, and so when the gland begins to swell, that really compresses structures within it, which can be extraordinarily painful for an individual. One of the more common causes of parotitis is mumps, which is a contagious viral disease, and sort of the hallmark of it is this very swollen red feature of the cheeks. Other causes of parotitis could include bacterial infection, could also include a sialolith or a salivary stone blocking Stenson's duct, which can build up saliva in the gland and also lead to swelling. But mumps is the most common cause of parotitis, and there is a very efficacious vaccine for mumps, which is part of the measles, mumps, and rubella vaccine that most people receive. Salivary tumors can affect any salivary gland, but they tend to be more common in the parotid gland. And you can remove parts of the parotid gland or the entirety of the parotid gland. This procedure is known as a parotidectomy. And when this is done, one wants to be very cautious to not interrupt any of the contents of the gland, notably the facial nerve branches, because that will affect facial expression on one side of the face, and certainly not external carotid artery or its branches, because that would cause quite a hemorrhage. So that leads us to our assessment question of the video, and that is, the parotid duct pierces which muscle before it enters the oral vestibule? Is it the buccinator? Yep, I do believe that's the correct answer. End of story. Thank you so much. No, I'm just joking. The masseter, no, it traverses the masseter. Omohyoid, nope, that's in the neck, orbicularis oris. No, that would be too far anterior. Sternocleidomastoid, no, that's also in the neck. So yep, just to make sure, buccinator, correct answer. The Stenson's duct is moving through that buccal space. It's going to pierce through the buccopharyngeal fascia, then through the buccinator, then through the oral mucosa. So there's a papilla there just adjacent to the second molar. So buccinator is the correct answer here. Thank you so much for your time, and I look forward to talking to you in the next video.